Diana Shrum, the daughter of Mr. Lonnie Shrum, asked me to make this video for her and her family. She wants all of you to know step by step how Kaiser Permanente killed her father. This video has two parts entitled Premeditated Murder 2 and Premeditated Murder 3. I personally would like to ask you, the viewer, to take a few extra minutes and watch both of them. You will understand how Kaiser Permanente is killing their patients. A sequence of events will show the same criminal behavior by Kaiser Permanente's professors and resident doctors of their graduate medical education program, working together at their main teaching hospital, the Los Angeles Medical Center. The events that I am about to show you has a direct link to Kaiser's attempt of premeditated murder of at least another Kaiser's patient, Mr. Moran-Pitou. Both of them paid Kaiser Permanente a big portion of their monthly income, expecting in return medical care. Both of them were Medicare patients. Both of them have had liver transplants. Both of them were sent from their local Kaiser's hospital to Kaiser's main teaching hospital, the Los Angeles Medical Center. They fell into the same criminal hands of the very same doctors, Dr. Tsai, Dr. Wu, and Dr. Toon. But Mr. Lonnie Shrum was killed, and Mr. Moran-Pitou survived. How? Both of them were prescribed by those doctors to take a medication called rapamune. Mr. Moran-Pitou refused to take it. Sadly, Mr. Lonnie Shrum, trusting these doctors, ingested it and lost his life. Although we, the American citizens, do not tolerate crimes such as children molestation, animal cruelty, and more, we are allowing our citizens by the millions, from newborns to senior citizens, to be used and abused by Kaiser Permanente's teaching hospitals. If Kaiser Permanente continues to be allowed to kill, to be allowed to deny and delay medical care to millions, and the federal and state governments have not been able to stop Kaiser's assassin doctors, then who will? You. You will have to take this difficult task. Please educate yourself about this criminal medical organization. Thank you.
FDA is alerting healthcare professionals that stable liver transplant patients may have an increased risk of death if they're switched from an immunosuppressive regimen based on a calcineurin inhibitor to sirolimus. Sirolimus, which is marketed as Rapamune, is approved to prevent organ rejection in patients 13 and older who receive kidney transplants. It's not approved to treat patients with liver or lung transplants.
The higher mortality risk was found in a clinical trial conducted by Wyeth, the manufacturer of Rapamune. The trial also suggested that patients converted to Rapamune were more likely to experience treatment failure at 1 year and more likely to discontinue the drug because of adverse events than patients who remained on CNI-based therapy.
FDA is reminding healthcare professionals that the boxed warning for Rapamune states that the safety and efficacy of the drug as an immunosuppressant have not been established in liver or lung transplant patients. FDA's alert also points out that therapeutic drug monitoring is recommended for all Rapamune patients, but that it shouldn't be used as the sole basis for adjusting Rapamune therapy. The patient's signs and symptoms should also be considered, along with tissue biopsy and laboratory findings.